All right, hello everyone. So today we're going to be talking about aging and mild cognitive impairment. So first we're going to start off by testing your cognitive skills a little bit. So what we want you to do is store these 3 words in your memory and we'll see how everyone remembers them at the end of the presentation. So the words are apple, house, pencil. All right. So let's start off with some background information about what MCI actually is. So some people suffering from memory problems have a condition called mild cognitive impairment, or MCI. MCI is divided into a few different categories, including amnestic MCI, or AMCI. Those with AMCI have symptoms that are not as severe as those with Alzheimer's disease, or AD, but they have more memory problems than normal people for their age. So people with MCI are able to carry out their daily activities, but they may begin losing things often, forgetting appointments or events, or having more trouble coming up with words than what's normal for people their age. MCI is defined by memory deficits that do not impact someone's daily function in a significant way. Their memory problems may be mild and hardly noticeable to the individual, and they can be compensated for by taking notes and writing reminders. In MCI, memory deficits can remain stable for years and often do not progress for long stretches of time. However, MCI does progress in some people and can present as cognitive deficits and function impairments consistent with Alzheimer's disease. However, the diagnosis of MCI depends on the individual's ability to perform their activities of daily living without more assistance from others than they previously needed. So in many cases of those with MCI, they will be aware of their memory difficulties and they'll attempt to compensate by increasing their reliance on notes and calendars. And many times patients will complain about trouble remembering the names of people they've recently met, as well as an increased propensity for losing objects. Some gradual mental and cognitive decline is expected with normal aging, such as slowing of mental processing, speed of performance, and the ability to learn new information. And additionally, there's an increase in the ability to become distracted. However, normal aging does not affect the intelligence, recognition, long-term memory, overall functioning, or ability to perform activities of daily living. And with MCI, a person regularly forgets information and conversations that someone their age would normally remember, rather than just forgetting things like names and words. And the American Academy of Neurology estimates that about 8% of people aged 65 to 69, 15% of people aged 75 to 79, 25% of people 80 to 84, and 37% of people 85 years of age and older present with symptoms of MCI. So the main symptoms of MCI. The first main symptom of MCI is memory loss in the form of repeating questions and stories, forgetting the names of close family members or friends, forgetting important events or appointments, misplacing items very often, and forgetting conversations. And the second symptom is language problems, such as having difficulty understanding written and verbal information or trouble coming up with the correct words when they're attempting to. So the third symptom of MCI is struggling with complex decision-making, such as having trouble paying bills, shopping, cooking, cleaning, and things like that. The fourth major symptom of MCI is a decreased sense of reasoning and judgment, including struggling with problem solving, making decisions, and planning. And finally, a fifth major symptom is a loss of focus and attention and being very easily distracted. So, the possible causes of MCI. A complete list of all of the causes of MCI has not been discovered as of yet, but there are a lot of possible conditions that may cause symptoms seen in mild cognitive impairment. And some of these symptoms include depression, stress, anxiety, sleep apnea, tumors, blood clots, stroke, low vitamin B12 levels, prescription side effects, a history of alcoholism, or thyroid, kidney, and liver problems. And many of these symptoms can be treated, and therefore the MCI associated with them may disappear as well. However, most cases of MCI are due to a variety of diseases such as Parkinson's disease or Alzheimer's disease, which as of now cannot be treated in the same way as the other symptoms. All right, now on to Bree.
Okay, So now we're going to talk about MCI and dementia. First things first, a common misconception is that MCI is part of normal aging, and that is actually not the case. There are some normal deteriorations that do occur in your brain that Alex is going to give us more information about in the next upcoming slides. But MCI occurs due to abnormal changes in your brain, so it is not considered a normal part of aging. Another misconception is that MCI is a form of dementia, which it is not. There's about 10 to 15% of people that have MCI that will develop dementia. And there are several different types of dementia, which include vascular dementia, Lewy body dementia, frontotemporal dementia, mixed dementia, which involves a couple of those combined. And then the most common one that we know is Alzheimer's disease. So unlike MCI, Alzheimer's disease does interfere with a person's ability to complete activities of daily living. It's a progressive disease, meaning that it gets worse the longer you have it, and it is the sixth leading cause of death in the United States. So now we're going to talk a little bit about how MCI is diagnosed. And this is a complex process and involves multiple steps. Physicians could look at someone's past medical history. They could go through a physical exam, and what they're looking for is cardiac dysfunction, because oftentimes those can replicate symptoms of MCI. They'll also look at a medication list and see if any side effects of those medications could cause mild cognitive impairment symptoms. Other types of exams that they could do would be more cognitive based, which I'm going to go into in the next slide. They could do performance based exams, which are going to assess someone's balance or their reaction to things. They could look at brain scans or lab results. They can undergo psychiatric evaluations and then also undergo genetic testing. Now, most often the person that's doing the diagnosing of MCI is the patient's primary care physician, and that just tends to be because the doctor is the person that they're seeing most often. So when these symptoms and changes start to occur, that's the first person that's aware of the changes. But other people that could help with diagnosing of MCI is a psychiatrist or a psychologist, a geriatric specialist, or even neurologists. So now we're going to talk about cognitive exams. And there are several different types of cognitive exams, but these were the three most common ones that I found. The first one is the Montreal Cognitive Assessment, also known as the MoCA. And although this one is the longest of all of them, it only takes 10 to 15 minutes. So what it involves is memorizing a list of words, similar to how we're having you guys do right now. Identifying pictures, so they'll show a picture of a cat and ask the individual to identify what the object is, and then replicate a drawing. So they'll show them a picture of a flower and then ask them to replicate the drawing of that. The second most common cognitive exam is the mini mental state exam, the MMSE. And this one is similar to a concussion screening. So they'll ask the patient to recall the current date or perhaps their birth date or their anniversary, something that they should be able to recall fairly easily. They'll also ask them to count backwards. And then this one also involves object naming. And then the third and the quickest one is called the mini cog. So they will recall 3 words. And then a big component of this is drawing a clock, which is what these pictures are showing here. And that is scored several different ways. So first, they might just globally look at the picture and assess what's going on. Is the drawing symmetrical? Does it have all the numbers it should? Are they equally spaced? And then they could also ask the patient to draw a specific time. So, draw me a clock that shows 3 o'clock. So are they able to correctly demonstrate that they know how to draw that and replicate what time that should be on the clock? So with all these tests and measures, it's important to know that whether or not someone tests positive or the results are abnormal, that does not tell us what the impairment is being caused by. So Alex is now going to give us some more information about the neurological aspects of MCI and help us understand maybe how some lab results or brain imaging scans could give us more information as to what's happening and what's causing these impairments.
Okay, we're going to talk about age-related changes that happen to the brain. So just like any other structure of the body, the brain will change as we age. The decline in mental ability is highly variable between people, with it normally being very gradual, but for some, the decline is very rapid. And then there are those who are able to maintain their cognition throughout their life. The top graph here is one taken from the book, and this was 3 individuals who were given a battery of cognition tests annually for decades. And you can see individual A here kind of reached their 80s and declined very rapidly. Then you have individual B and C who were able to maintain their cognition and kind of veered off, with individual B declining a little bit more, and then individual C actually getting a little bit better before declining again in their 90s. And we also know that changes are not uniform throughout the brain, with some areas shrinking more rapidly than others. The prefrontal cortex, the cerebellum, and the hippocampus are ones that are affected the most. Continuing on with age-related changes, in normal aging, the brain will shrink in volume, and it'll experience a loss of both gray and white matter, along with enlargement of the cerebral ventricles. And this is shown in an image from the book here on the right. It's a T1 MRI. This is the normal 22-year-old brain on the left, and on the right, you see in comparison a normal 89-year-old brain. And here is that ventricular enlargement that we talked about, and the kind of loss of tissue here in that frontal cortex. And after the age of 40, we have about a 5% decrease in brain volume per decade, with this percentage actually increasing for those over 70. It is thought that brain shrinkage is due to cell death, and it's true there is some loss of cells, but overall the brain experiences little cell death. Instead, it's postulated that neuronal volume, rather than number, is a contributing factor. Okay, so analyses of both human and animal brains have shown changes in both neurons and glia. And like we talked about earlier, there is both a loss of gray matter and white matter. Longitudinal MRI studies have shown that age-related reductions in gray matter are most prominent in the temporal and the frontal lobes. You will also see changes in densities of dendrites of cortical neurons, with these branches becoming less complex, and you will also see a loss of dendritic spines, which is shown here on an image, again from the book on the right. So on the top, you will see the dendrites of a young rodent versus that of an aged one. The level of enzymes that synthesize neurotransmitters like dopamine, norepinephrine, and acetylcholine will decline as we age, which results in functional deficits in the synapses that use these transmitters. And then consequently, these structural changes will lead to functional deficits at these central synapses. And then the white matter loss is really affected by the deterioration of the myelin sheath, which is often seen in the prefrontal and the temporal cortex. So this is another image from the book that's kind of bringing all these concepts together. The top is showing a normal brain, and then the bottom is a person with Alzheimer's disease. And you can see the things we talked about here, where that ventricular enlargement and that brain shrinkage. Okay, now we're going to talk about imaging and biomarkers. And biomarkers are being used to see if someone will progress from MCI to Alzheimer's or dementia. MRI scans can reveal if somebody with MCI will progress to something more severe, such as Alzheimer's, with 80% accuracy. And these are based on 3 things. You have cortical thinning, ventricular enlargement, and then atrophy of the medial temporal lobe and the hippocampus. So the image on the left here is showing the difference in patients. So you have somebody with normal cognition on the left. B is somebody with MCI. And then C is going to be somebody with Alzheimer's. So you can see that ventricular enlargement progressing there. And you can also see in this view that atrophy of the hippocampus. And these changes are going to be mild in the cognitively intact elderly people. And then in comparison, they're going to be very severe in those with advanced Alzheimer's. Okay, and then further autopsies have shown that there's similarities in those with MCI and then those with Alzheimer's. And these similarities have led to the ability of early detection. And then some of these alterations in the brain include a buildup of proteins that become toxic to it. And the two main ones looked in MCI are ones that I have in bold here. So the first one is the beta amyloid proteins. And when they come together in a group, they're kind of known as plaques. And usually they're surrounded by swollen axons and dendrites, like you can see on the picture here, surrounding that swollen dendrite there. And then the second one is the tau proteins, or tangles. And these are typically found in cell bodies and the proximal dendrites here. Other comparisons that were seen were Lewy bodies, which are microscopic clumps of another protein, but this is most common in those with Parkinson's, dementia with Lewy bodies, and in some cases you can find it in those with Alzheimer's. And finally, the last similarity that was seen was small strokes or reduced blood flow through the brain vessels. So these two proteins that we talked about are now being used as biomarkers in cerebrospinal fluid to predict the conversion of MCI to more serious dementias like Alzheimer's. And this picture on the right is just pretty much just another picture showing here. So these plaques and tangles can now be visualized using positron emission tomography, or PET scans. And then several studies have indicated that subjects with MCI who have positive amyloid PET scans are more likely to progress rapidly. The image on the right here is showing normal cognition on the left, MCI in the middle, and then somebody with Alzheimer's on the right. The yellow and red areas are demonstrating that those areas increase in plaque buildup, with the most retention being seen here in subject C. Okay, and this is just an image putting pretty much all the imaging we just looked at with cognitively normal, MCI, and dementia. The top having the MRI, and then you can see here the amyloid PET scans and then the tau PET scans. And now Bess is going to talk about treatment.
So there are many treatments for MCI-related symptoms, such as pharmacological, supplements, alternative or cognitive therapies, or lifestyle changes. However, the effectiveness of each treatment depends on the stage of MCI, Alzheimer's, or dementia. So first we have those pharmacological treatments. However, for MCI alone, the FDA has not approved any single medication, but still some are used to treat dementia and Alzheimer's disease. To slow the progression of Alzheimer's disease, the two main medications used are cholinesterase inhibitors and memantine. The three cholinesterase inhibitors are donepezil, rivastigmine, and galantamine. They treat mild to moderate stages of Alzheimer's, helping MCI symptoms related to lapses in memory, thinking, judgment, and other thought processes. So low levels of acetylcholine have been shown to cause some symptoms related to Alzheimer's disease. And acetylcholine is important for learning and memory. And cholinesterase inhibitors prevent acetylcholinesterase from breaking down acetylcholine in the synaptic cleft between neurons, therefore increasing the concentration of acetylcholine in the brain. Memantine is another Alzheimer's disease medication. And for those moderate to severe cases, memantine can be used alone or in combination with cholinesterase inhibitors because it works as a glutamate regulator, and that improves mental processing, memory storage, and retrieval in those patients. Since an accumulation of amyloid beta protein that Alex mentioned is common in Alzheimer's disease and can impair how much glutamate is taken up by those astrocytes in the brain, this regulation of glutamate helps to avoid ultimate cell death. Other forms of dementia can possibly benefit from these drugs as well, including Parkinson's disease dementia and Lewy body dementia. All right, next we have some natural supplements. These mostly show conflicting evidence in treating symptoms related to MCI. First, we have vitamin E, and this is an antioxidant micronutrient that protects cells from oxidative damage, so often seen in brain aging and Alzheimer's disease patients. There have been animal studies that have shown evidence to consider a treatment with vitamin E for patients suffering from Alzheimer's, but these studies have yet to be produced in human subjects. Next, we have coconut oil, and coconut oil contains a fat called caprylic acid that can be broken down into ketone bodies. And these ketone bodies can provide an alternative energy source for brain cells that have lost their ability to effectively use glucose. Additionally, research has shown that omega-3 fatty acids have a positive correlation with elevated blood flow to the brain and higher cognition. Finally, vitamin B12 deficiency is also associated with dementia and low cognitive function, but it's not clear whether vitamin B12 supplements actually help prevent or treat MCI. Okay, next we have some herbal remedies, and these have also been shown to treat MCI. Ginkgo biloba is a plant extract that may play a role in regulating neurotransmitter function and improving cognitive decline when used with conventional medicine. Experimentally, chodo-san and kami untanto are two other herbal remedies shown to possibly slow the progression of Alzheimer's disease in rats. Next, acupuncture has also been linked to improving cognitive function in Alzheimer's disease, as well as bright light therapy. And since sleep disturbances are common in Alzheimer's and dementia, bright light therapy has been introduced to patients to regulate circadian rhythms into a more normal sleep cycle and may improve the ability for them to sleep at night. All right, next we have some cognitive therapies used to treat MCI. So cognitive stimulation therapy uses themed activities to keep patients with mild to moderate dementia or Alzheimer's disease engaged and learn. It can be done one-on-one or in a group and can include activities such as comparing memories from childhood to today, remembering names of actors or actresses, or reading news articles. Additionally, helping patients with auditory and visual recall are other important interventions when treating MCI, Alzheimer's, and dementia. So for example, you could show your patient a picture, like the second picture shown here at the bottom. You show that picture for a couple minutes, take that picture away, and ask the patient to recite all the pictures that they remember. Similarly, you could read a short story out loud to your patient and ask them to remember the details about the story. So both of these methods can enhance the recall ability of MCI patients. All right, finally, lifestyle activities such as exercise and meditation have been suggested also to improve MCI symptoms. In several small studies, meditation has been shown to increase cognition. Still, it's unknown if meditation boosts general wellness by reducing anxiety, insomnia, and cardiovascular disease, or if it directly improves MCI. Additionally, exercise combined with cognitive interventions can also improve symptoms. And some with MCI have been shown to return to normal cognitive function following intervention. So one study showed that over 50% of participants over 65 reverted from having MCI to normal cognition after the study. So these are the participants who took part in functional lifestyle activities like playing sports, continuing with their hobbies, reading books, or using maps to travel to unfamiliar places. So to slow the progression of MCI, multiple interventions may be beneficial. It just depends on your patient and the severity of their symptoms. All right, so at the beginning of the presentation, Alyssa asked you guys if you could remember 3 words on that mini cog exam that Bree mentioned in her section. So who remembers what those words were?